If you're taking thyroid medications but still feeling exhausted, gaining weight, or dealing with brain fog, the problem might not be your dose or your thyroid. It might actually be that your body isn't absorbing the medication that you're paying for. I'm Olga, and I work with providers on medication optimization every day. I'm going to show you the absorption factors that can make or break your thyroid treatment. Let me be transparent about why I'm passionate about this topic. I have a naturopathic doctorate and I work as a pharmacy liaison, which means I spend my time helping healthcare providers understand why medications work for some patients and not others. Thyroid medication is one of the most commonly prescribed drugs in America, yet I see patients struggling with symptoms despite being on treatment. What's frustrating is that most of these absorption issues are completely fixable once you understand the pharmaceutical science behind how thyroid hormones work in your body. Today, we're going to dive into the factors that can block absorption, the timing mistakes that sabotage your treatment, and the questions you need to ask your provider to get your medication actually working for your thyroid. Here's something that might shock you. Thyroid medications have some of the pickiest absorption requirements of any drug that you take. Levothyroxine, the most common thyroid medication, needs very specific conditions to be absorbed properly. First, it needs stomach acid. If you have low stomach acid, which becomes more common as we age, or if you're taking acid blocking medications, your thyroid medication might pass through you unabsorbed. Studies show that people taking proton pump inhibitors like omeprazole need 25 to 50% higher doses of thyroid medication to achieve the same blood levels. Second, it needs to be taken on an empty stomach. Food, especially anything with calcium, iron, or fiber, can reduce absorption by 40 to 80%. That morning coffee with cream, it's potentially blocking your medication. That multivitamin that you take with breakfast, same problem. The third timing window is much narrower than most people realize. The research shows that thyroid medication should be taken 30 to 60 minutes before eating anything, and you need to wait at least 4 hours before taking calcium, iron, or other supplements. Here's what's really interesting. Even with perfect timing, some people still don't absorb thyroid medications well. Studies show that about 15% of people have genetic variations or gut issues that significantly impair levothyroxine absorption, which is why some patients need liquid formulation, different brands, or even compounded versions. Let me walk you through the medication and supplement interaction that can sabotage your thyroid treatment because some of these are incredibly common. Calcium supplements are probably the biggest culprit. Calcium binds to thyroid hormone in your intestine and prevents absorption. If you're taking calcium for bone health, which many thyroid patients need because untreated hypothyroidism affects bone density, you absolutely must separate it from your thyroid medication by at least 4 hours. Iron supplements do the same thing. This is particularly problematic because many thyroid patients also have iron deficiency. I've seen patients chase thyroid symptoms for months, increasing their thyroid dose repeatedly, when the real problem was that their iron supplement was blocking absorption. Coffee is another huge factor that most people don't realize. Studies show that coffee can reduce levothyroxine absorption by 25 to 55%. So if you're someone who takes your thyroid medication and immediately drinks coffee, you might be getting half of the dose that you think you're getting. Here's something fascinating. The timing of these interactions matters more than the substances themselves. If you take your thyroid medication first thing in the morning, wait an hour, then have coffee and your other supplements. You can avoid most of these problems that way entirely. What's really interesting is that some foods can actually help absorption. Taking thyroid medication with a small amount of water and waiting for the full hour before eating generally gives the best absorption. But some studies suggest that certain amino acids might actually enhance uptake. Now let's talk about something that can be life-changing for some thyroid patients. Not everyone does well on a standard levothyroxine dose, and it's not because they're being difficult or imagining things. About 10 to 15% of people have genetic variations in how they convert T4, the inactive form of most thyroid medications, to T3, the active form your cells actually use. These people might have perfect T4 levels on blood tests, but still feel terrible because they're not making enough of the active hormones. For these patients, combination therapy with both T4 and T3, or even T3 only treatment, can be dramatically effective. The research on this is growing, and some endocrinologists are becoming more open to trying different approaches when standard treatments aren't working. There's also the issue of inactive ingredients. Some people are sensitive to dyes, fillers, or preservatives in the commercial thyroid medications. I've seen patients who can't tolerate any brand of levothyroxine but did beautifully on a compounded version with different inactive ingredients. Different brands of thyroid medication can also have different absorption characteristics. Synthroid, Levoxyl, Tirosint, they're all levothyroxine, but they're not identical. Some people find that switching brands might make a difference in how they feel, even if blood levels look similar. This is where working with a knowledgeable provider becomes crucial. Someone who understands that normal TSH doesn't automatically mean optimal treatment and who's willing to look at the whole picture, your symptoms, your absorption factors, and your individual response. Let me give you a practical framework for getting the most out of your thyroid medications. First, perfect your timing routine. Take your thyroid first thing in the morning with water only. Set a timer for 1 hour before drinking or eating anything except for water. If you absolutely can't wait an hour, wait at least 30 minutes, but know that your absorption might be affected. Second, create a supplement schedule that works with your medication. Take calcium, iron, and multivitamins at least 4 hours after your thyroid medications. If you take multiple doses of supplements daily, the evening dose is usually the safest bet. Third, track your symptoms and energy patterns. Keep a simple log of how you feel each day, your energy levels, sleep quality, and any symptoms. This data will help you and your provider determine if your current approach is working. Fourth, understand your lab values. TSH is important, but it's not the whole story. Ask for free T4 and free T3 levels too. Some people feel best with TSH in their lower part of normal range, while others do better in the middle. There's no one-size-fits-all target. Fifth, be prepared to advocate for yourself. If you're still symptomatic, despite normal labs and perfect medication timing, don't let anyone tell you it's all in your head. There are legitimate reasons why some people need different approaches, and finding a provider who understands this can be life-changing. Here's what I want you to remember. Thyroid medication can be incredibly effective, but only if it's actually getting absorbed and converted properly in your body. The timing and interaction issues that we discussed today are completely fixable with the right information. Most people can dramatically improve their thyroid treatment just by optimizing when and how they take their medication. But if you've perfected your timing and you're still struggling, don't give up. There are legitimate reasons why some people need different formulations, different dosing approaches, or combination therapy. The key is finding a provider who understands that normal labs don't always equal optimal treatment. Your thyroid affects every cell in your body: your energy, your weight, your mood, and your brain function. Getting this right is worth the effort it takes to optimize your approach. What's been your experience with thyroid medication? Have you noticed differences with timing, different brands, or other factors? Share your story in the comments. Your experience might help someone else get the relief that they've been looking for. If you want more evidence-based information about optimizing your health through better understanding of how medication and supplements actually work in your body, subscribe for content that bridges the gap between pharmaceutical science and practical health solutions.